Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Diuretics, we're looking at the excretion of the electrolytes. So the first one will be, we are looking at the CAI. So CAI stands for the carbonic anhydrase inhibitors. So we'll be looking at the three segments. That is, firstly, we'll be looking at sodium, then the potassium as well as the calcium. So sodium, potassium, calcium. So in terms of the calcium anhydrase inhibitors, so here the sodium will increase and the potassium will also increase, and there is no change in the calcium. Then when you look at the OD, that is the osmotic diuretics, there is a similar pattern, that is, there is a higher increase of sodium, there is an increase in potassium as well as there is increase in the calcium. So all three will increase in terms of the osmotic diuretics. Now when you go further to the LDs, that is the loop diuretics, there is an equal significant increase of the sodium, potassium as well as the calcium. So what is the thing we are looking here is that in terms of calcium there is no change, and this was brought by the CAI. Now let's learn about other drugs as well. So now when we look at the thiazides, so in terms of thiazides there is an increase. There's an increase in sodium, there's an increase in potassium, it is slightly significant, and there is a decrease in the calcium. So this is the first place we are seeing a decrease in the calcium is by the thiazides. Then we move on to the epithelial sodium channel blockers. So in terms of epithelial sodium channel, so in the epithelial sodium channel blockers there will be an increase. So this increase is brought by the sodium, and there is a decrease. So this decrease is brought by the potassium as well as the calcium. Now let's look at the aldosterone antagonist. So in terms of the aldosterone antagonist, there will be an increase in the sodium. So there is an increase in the sodium, there is a decrease in the potassium, and calcium, it is not well studied. So in epithelial there will be a 2 decrease. So this is very important. In thiazides there was a single decrease of calcium, but as in epithelial there is a double decrease of the potassium as well as the calcium, and aldosterone there is a decrease in the potassium level. To learn and grow daily like this, please do subscribe.